I tell my patients often, in orthopedics, you don't want to be an interesting case, but if you are, you want to get your care right here. With foot and ankle surgery, the goal is really to get people back moving. And most importantly, I want to get you back permanently, not just once and then all of a sudden you're injured again. UPMC has a comprehensive care delivery model across the entire treatment span, from rehabilitation all the way through rehab. We have everything the patient would need to get better. My name is Dr. McAllis Hogan, and I choose to practice orthopedic surgery at UPMC.
I'm Chapella Daima Swin Lewis. I love gardening, I love sewing and costume making, but I also am a food service manager with the Howard County Public Schools. I have had nothing but positive experiences with Kaiser. I was on Medicaid when I first joined Kaiser, and now that I'm gainfully employed, I wanted to make sure that I was able to keep Kaiser as my provider. My past experiences with other HMOs through Medicaid was awful. You know, they see the Medicaid card come out and they just treat you different. You don't have a voice, you hardly have a name, you're not allowed to ask questions. It's just, this is what it is, accept it, that's it. I didn't get treated like that at Kaiser. It's, what are your concerns? How can we help you? Do you have any questions? When you're treated with dignity, you're not apprehensive about visiting the doctor's office. I have absolute confidence in my doctor at Kaiser Permanente. And it makes me feel that much safer when I'm at work, being on the front line. It makes me feel that much more confident about my current health status as a parent. Kaiser is the best. That's how I feel. And I'm never leaving. I'm never leaving. I'm never leaving.
Hi, everyone. I'm Sherry Neal, Chief Diversity Officer for HCA Healthcare. And as a proud sponsor of the NACI 2021 Virtual Education Conference, I'd like to thank NACI President Fabian A. Stone and the rest of the Executive Committee for their leadership in empowering the next generation of healthcare leaders. HCA Healthcare has been a proud supporter of this conference for several years. And on behalf of our leadership, our entire leadership team, we're really happy to be a supporter again this year. Once again, NACI has managed to instill the same amazing energy virtually as the in-person conference, although I know that we really miss being in person together. You know, this past year has been incredibly difficult for our industry and our world, but I'm grateful to NACI for allowing us to stay connected to discuss solutions for some of the biggest challenges facing healthcare today. Over the past year, HCA Healthcare has raised the bar by advancing our commitment to diversity, equity, and inclusion through a more sustainable and data-driven approach. And just as we united in the fight against COVID-19, we've joined together in tackling issues that create barriers to a sense of belonging for our patients, our colleagues, and our communities. We look forward to continuing to partner with NACI to further our commitment to strengthening the diversity of our talent pipeline at all levels. Thank you, NACI, for this wonderful conference. We're so grateful for our partnership and your dedication to improve quality, access, and availability of health services to underserved communities and to expand educational opportunities for Black executives in healthcare. Now, let's continue to be audacious in our actions to create a healthier, more equitable tomorrow.
Good morning, NACI family and friends, and welcome to the 2021 NACI Virtual Education Conference. My name is Dana Weston Graves, and I, along with Brian Woodford, have had the honor of serving as your conference co-chairs. It was our hope to see the NACI family in person this year, but your health and safety is our top priority. So we put together a condensed but powerful virtual conference that you are sure to enjoy. Before we begin, I want to thank our sponsors for their commitment to NACI and for making this conference possible. We appreciate you. Next, I want to thank all of the members of our conference committee for their hard work. It is not easy to plan a virtual conference. And thank you to our national president, Fabian Stone, our executive director, Lisa Mallory, and the NACI staff for their dedication and commitment, not only to this conference, but to our organization. Okay, let's get this conference started. We are going to kick things off right now with our Diversity Leadership Forum, sponsored by Sentara Healthcare. Get ready for a great discussion on diversity, equity, and inclusion. At the end of this panel, we'll award the Young Healthcare Executive of the Year and the Senior Healthcare Executive of the Year awards. The next up on today's schedule, we have an education session at 1 p.m. Eastern Time titled Black Faces in White Spaces, Preserving the Mental Health of Black Professionals. Then we'll conclude day one with our Young Professionals Forum at 2 p.m. Eastern Time, which has a dynamic panel ready to engage with our young professionals and early careerists. Thank you for joining us. We are so glad that you're here. And now I will turn it over to our National President, Fabian Stone, for a special presentation.
Good morning, and thank you, Dana. At this time, I would like to read the resolutions for two of our past national presidents. I respectfully ask you to join me in a moment of silence in the memory of Dr. Sandra Gould, NACI's 19th national president, who passed away in July 1st, 2021, and Mr. Percy Allen II, NACI's 14th national president, who passed away on September 12th, 2021. And now I shall read the abbreviated resolutions in recognition of past President Sandra Gould and past President Percy Allen II. The entire resolution will be posted on our website. Resolution in honor of the recognition of Dr. Sandra Gould, 19th President of the National Association of Health Services Executives. Whereas the Board of Directors, state and local leaders, other members, and staff of the National Association of Health Services Executives humbly acknowledge the passing of the loyal and dedicated 19th National President of NACI and the exemplary healthcare executive, Dr. Mrs. Reverend Sandra Gould, a dinosaur. Where there is now silence in our heart and an immense void at this 2021 NACI National Conference, as we reflect, celebrate, and honor the life of the third woman president in the history of the National Association of Health Services Executives. Whereas we commend past President Sandra Gould, the original dinosaur, for her unselfish, dedicated, and service to NACI and the healthcare profession and inspiring healthcare executives. Whereas Sandra referred to as NACI's Renaissance woman for her various interests and intellect, in 1998, she received NACI's Senior Executive of the Year Award at the 13th Annual Education Program and Exhibit in Philadelphia. She was also past president of the New York chapter of NACI and served as the secretary and president-elect for the national organization. She was a fellow in the American College of Health Services Executives. Whereas Sandra's unremitting service to NACI's national president in 2001 to 2003 delivered a remarkable record of accomplishments. Significantly, Dr. Gould persevered after September 11, 2001 terrorists at the World Trade Center, the Pentagon, and the downed United Airlines flight in Western Pennsylvania, where over 3,000 lives were lost, to continue with the 16th annual meeting in New Orleans with the theme, Strategies for Healthcare Professionals, Building on a Solid Foundation. Whereas Sandra, a woman of faith, actively engaged her husband, the Reverend James E. Gould, pastor of the Jerusalem Baptist Church in Milton, New York, into the emotional healing process of NACI following the terrorist attack. Be it known, we are grateful for NACI's dinosaur Sandra R. Gould, RN, MS, PhD, FACHE, giving her all to the advancing the youth movement in NACI and making a difference in our lives. Furthermore, we will cherish the memories of Sandra and the faith that she had in God and the love for her family and friends. Therefore, be it resolved, we commit to honoring Dinosaur Sandra R. Gould by continuing her commitment and dedication to service the mission of NACI by training the next generation of leaders. Be it further resolved, a copy of this resolution will be entered permanently into the minutes of the National Association of Health Service Executives Governing Board. Humbly submitted this day, October the 13th, 2021, the National Association of Health Services Executives, Fabian A. Stone, President, 2019 to 2021. Now, I will allow you to hear from Reverend James Gould for comments.
Good morning. On behalf of the Gould family, my 7 children and 13 grandchildren and 6 great-grandchildren, we do humbly accept this resolution coming from the National Association of Health Service Executives. We are truly excited in receiving this because we know that the Dr. Sandra Gould loved NACI. And because of her love for NACI, she did whatever she could to promote the organization. She not only was herself a participant, she made the family a participant, especially myself as her husband. When I look at all of the accolades that were stated in the resolution and that were a part of her obituary, we all have a beginning. Many years ago, her grandmother asked her, "What do you plan to do with your life?" And she told her grandmother she wanted to be a teacher. Her grandmother evidently was very influential because her grandmother said, "No, you don't want to be a teacher, you want to become a nurse." And when I look at this picture, this is where she began her journey in healthcare. She nursed at Bellevue Hospital in New York City. Those were the days when you as a nurse did everything, including bedpans. And she had no problem with that. I just want to state that even today, when we talk about her being a dinosaur, she still would cringe when she saw nurses not wearing dresses and not wearing their caps. But again, NACI, I want to thank you for recognizing her and her efforts. Many of you in the audience know who she was and know what she did. And truly, we are grateful that you are recognizing her for what she has done. I just believe that the Lord, in whose bosom she's now residing, will give her that salutation: "Thy good and faithful servant, you've been faithful over just a few things. I'll now make you ruler over many things. Enter thou into the joy of the Lord."
Reverend Gould, thank you so much for those words on behalf of your family. We are truly honored again to have had Dr. Gould as part of our NACI family, and we thank you for sharing her with us. So again, anything that we NACI can do to support you or the mission, please let us know, and thank you so very, very much. Resolution of Honor. In recognition of Mr. Percy Allen II, 14th President of the National Association of Health Services Executives. Whereas the Board of Directors, state and local leaders, other members, and the staff of the National Association of Health Services Executives humbly acknowledge the passing of the loyal and dedicated 14th National President of the National Association of Healthcare Executives, an exemplary healthcare executive, Mr. Percy Allen II, Godfather of NACI. Where there is now silence in our hearts and an immeasurable void at the 2021 National Conference, as we reflect, celebrate, and honor the life of one of our most illustrious members in the history of the National Association of Health Service Executives. Whereas we commend past President Percy Allen II, the godfather of NASI, for his unselfish dedication and service to NASI and the healthcare profession and inspiring healthcare executives. Whereas Percy unremittingly served as NASI's national president in 1991 to 1993, he delivered a remarkable record of accomplishments. Significantly, the godfather of NASI provided testimonies before the White House Task Force on Healthcare Reform in the old executive mansion of Washington. He negotiated our initial contracts with ServiceMaster to fund NASI student scholarship, and Abbott Laboratories and Baxter International became one of the corporate sponsors for our organization. In 2010, Percy arranged that NASI's president and president-elect to travel to Washington, D.C. to testify on the U.S. House Oversight and Government Reform Committee under the committee chair, Ephilus Towns, Jr., Democrat of New York, under President Clinton. Whereas Percy received numerous awards and recognitions for his exemplary leadership and service as leading healthcare executive, in 2006, he was inducted into the NASI's Hall of Fame and received the American College of Healthcare Executives, ACHE, President's Award. NASI changed the name of the Chapter of the Year Award to Percy Allen II Chapter of the Year Award, and New York Regional Chapter of NASI created the Percy Allen II Senior Healthcare Leadership Award. Therefore, be it resolved, we commit to honoring our godfather Percy's life for continuing his commitment and dedication to service to the mission of eradicating healthcare disparities. Be it further resolved, a copy of this resolution will be entered permanently into the minutes of the National Association of Health Services Executives Governing Board. Humbly submitted this day, October the 13th, 2021, the National Association of Health Services Executives, Fabian A. Stone, President, 2019-2021. At this time, we will allow you to hear from Mrs. Faye Allen for comments.
I would like to extend appreciation for this resolution that acknowledges Percy's contribution to NASI. Everyone knows that he was passionate about the success, not only of the organization, but of the members, young and old, who were part of it. This was his life. A lot of what he did was behind the scene. He was not one for the limelight, but his influence and impact was felt by all. I tell the story of coming all the time with him to the NASI conferences, and when we got there, I lost him to everyone. Folks who just wanted to speak to him, just to say hello, others who were seeking advice, professional guidance, and he saw this as his opportunity to share his faith and to help and shape as many lives as he could. This resolution, I think, says it all. And I thank you on behalf of my family that you have acknowledged Percy with this resolution, and I hope that others will follow in his footsteps. Thank you, Fabian, for doing this for me.
Mrs. Allen, you're certainly welcome, and thank you for allowing Percy to be part of our family for so long. So thank you, thank you, thank you. And we here at NASI are here for you from this point going forward. So thank you again, Mrs. Allen.
At Sentara Healthcare, we improve health every day for all people. We believe that diversity, inclusion, and equity are facets of better healthcare, and better healthcare means healthier people and thriving communities. When you're at Sentara, we are committed to always keeping you safe, always treating you with dignity, respect, and compassion, always listening and responding to you, always keeping you informed and involved, and always working together as a team to provide you quality healthcare, no matter who you are, who you love, what language you speak, or where you come from. Whether you work here, receive care here, or are just coming to visit, you are welcome, safe, and valued at Sentara.
Good morning. I am Becky Sawyer, the Chief People Officer with Sentara Healthcare. And Sentara is very proud to be sponsoring today's event. Sentara, as you've just heard in the video, is very committed to being on a journey to improve diversity and health equity across our communities. As a founding member of the Virginia NACI chapter, we are happy to see you in the Diversity Forum this morning and participating in the National Education Conference. I want to thank today's panel for sharing your insights, and Dana Becton, our Chief Diversity Officer, and Dana Weston Graves, the President of Sentara Princess Anne Hospital, who are both part of our enterprise-wide Executive Council on Diversity at Sentara and participants in today's program. It is only through having an open mind and an open heart that we can truly achieve the visions of equity for all we have before us. I hope you enjoy your day together and are excited and inspired by all of the wonderful speakers. Thank you.
Thank you, Becky and Sentara Healthcare, for your sponsorship. And good morning, NACI family. Even though virtual, it is a delight, it's an honor, it's a pleasure to be with you again at this year's Diversity Leadership Forum. On behalf of my partner in crime and co-chair to this year's forum, Casey Willis Abner, we are excited about today's discussion, particularly given everything that we're seeing today within our industry. Everything from the great resignation and challenges that we're all having retaining our top talent, to the continuation of vaccine hesitancy, to right-sizing our workforce after the telehealth explosion. Yes, healthcare continues to transform, and today's panel of expert diversity officers will take us to school and share with us strategies to leverage diversity, equity, and inclusion to further achieve our mission and to grow our business within each of our respective organizations. We want to invite you into a conversation that we as diversity officers oftentimes have with each other. We often have this conversation behind closed doors, typically over a glass of wine or a glass of cognac, but it's real conversation amongst those of us who do this work and that are in the trenches. That's needed, especially today when it seems that most everybody has declared themselves a diversity expert. Before we do so, a couple of quick housekeeping announcements that we've been asked to share. First, on the homepage of this platform, your viewing screen can be viewed in full screen mode or in a minimized mode by clicking on the 4 arrows icon located in the lower right-hand corner of your screen. Second, if you'd like to ask any questions to our panelists during this session, make sure that your platform viewing screen is in the minimized position and click on the Q&A icon at the bottom of the page, which is where you can write your questions. Casey and I will attempt to share as many of your questions for the panel as possible. So please keep your questions coming. And lastly, at the bottom of your page, you'll see the platform offers a chat function. Feel free to use the chat function for any public comments that you wish to share with the full viewing audience, or reach out privately to any old NACI friends or colleagues whose names you see in the chat room as well. We ask that you please not share any questions that you have for the panelists in the chat room, but instead use the function that we described earlier. And now, having said that, I'd like to turn the virtual stage over to my friend and esteemed co-chair of this diversity forum, Casey Willis Abner.
Thank you, James, and thank you, Sentara and Becky, for starting us off and supporting this wonderful event. You know, I feel like I'm the luckiest person in this forum right now, because I actually have the pleasure of personally knowing and working with Becky, Pamela, Dana, and Rosalind, and definitely James. And so this truly is like a normal conversation that we would have in the evening, but instead of wine, I'm having coffee today. And so thank you all for joining us from across the country, across the world, likely. It's a privilege and a pleasure to be here today to set the stage as we go deep into how we believe we should be advancing diversity, developing inclusion, and elevating equity. And so without further ado, I'd like to introduce someone who many people think that we're sisters because who shares the last name of Abner. But Pamela Abner, I'd love for you to just give us a couple of minutes about who you are, where you work, and your experience in advancing diversity, equity, and inclusion at your organization. Pamela?
Thank you so much. And so good morning, everyone. And I'm thrilled and pleased to be here. And so Cassie, thank you for inviting me, number one. And yes, you are my sister in this body of work, right? No matter what. We've known each other for a long time. So I am currently the Vice President and Chief Diversity Operations Officer for Mount Sinai Health Hospital Groups. And Mount Sinai Health System is in New York City. We are an 8-hospital academic medical center. We have a medical school, nursing school, graduate school. At Sinai, we have a commitment to advance all tenets of diversity, equity, and inclusion, to enhance patient care and to address the specific needs of marginalized members of our community. We've been recognized, many times over for our early work in this space. Diversity Inc. recognized us and ranked us #1 for 2 consecutive years for the work that we do in advancing best practices in diversity, equity, and inclusion. More recently, our organization, our leaders have embarked on a very specific mission to advance and address matters related to racism. So we've adopted a roadmap, as we call it, a roadmap for action to address racism. And we've specifically identified strategies and interventions to dismantle and address those structures and oppressive practices within the organization. So we're really in the midst of that. And I look forward to sharing some more about the work that we do there.
Thank you, Pam. I really appreciate that and can't wait to hear more about the work that Mount Sinai continues to lead in this space. So next, we're going to go over to Dana Becton. Now, I want to be honest to say that I met Dana literally at the educational conference of NACI probably 3 years ago. We were in DC. And I had the opportunity to meet Dana. Her work preceded her. And so it's a pleasure to have Dana not only as a member of Sentara sponsoring this forum, but a member of this panel. So Dana, if you can introduce yourself.
Thank you so much, Casey and James and the entire NACI family. And I mean that seriously. It definitely is a family. I am Dana Becton. I am the VP and Chief Diversity Officer at Sentara Healthcare. We are a 12-hospital system across the state of Virginia with 1 hospital in North Carolina. I have been with Sentara now for a little over 2 years, and I am a part of a very mighty team and we are now the Center for Diversity, Inclusion, and Cultural Competency. We expanded our lens to the cultural competency piece this year, and we'll talk about this later, but understanding how COVID has impacted us, understanding the value and the need to address concerns of our patients from a cultural competency perspective really allowed us to open up this opportunity. I'm pleased to have my leader on the call as well, Becky Sawyer, as well as the other Dana Western Graves, who is one of our hospital presidents. The work that we do at Sentara, we're very proud. We've been awarded Forbes Best Place to Work for Women. All 12 of our hospitals for the first time last year became HEI leaders in healthcare. So the Healthcare Equality Index, that was a great endeavor that we went through. And we really are focused on 3 different lenses. We're looking at our workforce. How do we diversify? And what does it look like for us to attract, retain, and really develop our workforce? Looking at our workplace. What does that look like for us? Once we get you here, how do we make sure that this is an environment that you want to stay and that you can thrive in and create that sense of belonging, both for our employees as well as our patients? And then lastly, our strategic community partnerships. How do we really go back into the community and be strong partners? So I'm looking forward to having this conversation. I'm thrilled to be on a panel with Pamela. I've heard her talk, and Rosalind, I've also heard you talk. So I'm really excited to be here. Thank you.
And thank you so much, Dana. And now, last but definitely not least, is my friend and sister and colleague, Rosalind Carpenter. Rosalind, would you do us the pleasure of introducing yourself?
Absolutely. Thank you, Casey. Hello, everyone. I'm Rosalind Carpenter, Senior Vice President, Chief Diversity, Equity and Inclusion and Community Impact Officer for Common Spirit Health. Thank you, Casey and James, for having me at our NACI Diversity Summit. I'm looking forward to our real conversation about diversity. First, I bring to you Common Spirit Health greetings from our CEO, Lloyd Dean, and over 150,000 of our colleagues from across 21 states. Our commitment to NACI is ongoing and stronger than ever. We are returning Diamond sponsor for the 2021 virtual conference and the Everett V. Fox Student Case Competition. Simply put, we're here because you're here. We believe that NACI's mission to promote the advancement and development of Black health leaders is essential to elevating the quality of health services rendered to ethnic minority and underserved communities. We're here to help advance, develop, and elevate. I was asked to share a small bit about myself and background. I've been a part of Catholic Healthcare for 10 years, starting in Denver, Colorado through Catholic Health Initiatives under the leadership of Kevin Lofton and Pat Webb, and now a member of Common Spirit Health family under the leadership of Lloyd Dean. My accountabilities include vision, leadership, and enterprise management of diversity, health equity, and inclusion strategies, programs, and initiatives for the employees and patients and their families and the communities that we serve. I've held diversity leadership roles with HCA Healthcare and Health Trust Purchasing Group. I previously served as the president and CEO of the Urban League of Middle Tennessee in Nashville, as well as executive director of the Metro Human Relations Commission for Nashville and Davidson County. Presently, I serve on Meharry Medical College Health Policy Center National Advisory Board, the Catholic Health Association Special Committee to the Board on Diversity and Health Equity. I'm a founding member of the Black Directors Health Equity Agenda and a member of the inaugural First Group Allyship Roundtable, as well as Casey, the Press Ganey Diversity, Equity, and Inclusion Client Advisory Council. I'm a member of the Denver, Colorado chapter of the Links Incorporated. And lastly, I have the honor of saying that I was the founding president for the Greater Denver chapter, NACI chapter. Glad to be here. I look forward to our conversation, and thank you again for having me.
Excellent, excellent. Rosalind, Dana, Pamela, it is clear that we have the visionaries and the strategists within our industry who lead this work. So I'm really excited to tag team this thing with KC to begin our conversation. And so as diversity officers, we want to pick your brain and learn what's the inner thoughts that are going on in your mind around some of the top things that are top of mind for you during the resurgence of this pandemic. We've heard that it's going to be an aggressive flu season. Our children are back at school. What's top of mind for you, particularly as it pertains to the Delta variant and others, and what we're seeing by way of COVID continuing to surge?
I can jump in real quick. I think one thing that's top of mind for us is our workforce and how the resiliency of our workforce to be able to deal with the pandemic. And then when you layer on the complexities of what we've experienced over the past year and a half around the move around social justice and racial justice, it is one of those opportunities for us to really be there for our employees, for our team members. And I think just helping them deal with the complexities, not only from a workforce perspective, but these are their families. And now in healthcare with the vaccine mandates, that's an added complexity because we're looking at and being really mindful around who are the ones that are getting impacted by that the most.
Yeah, and I would just add that, I think, just add to what you said, Dana, that how we effectively communicate with folks, especially our employees, right? Because oftentimes the folks who work for us are part of our community. And what information do they need to hear so that they have a level of comfort and understanding? And I think what we learned most about this through this process in the pandemic was how much we really have to be in the community to understand what they need and not make decisions, ourselves without taking into consideration what's really concerning for them.
I agree with my colleagues here. Top of mind is workforce, resilience, self-care, and vaccines. There's a lot of movement, people leaving their jobs. Change is good, and certainly opportunities are being presented and represent gain for various careers. I encourage NACI careers to stay in healthcare. We want you here, you are needed, and you're valued in the work that we do in the communities that we serve. Resilience is also top of mind. Agility is required, so be flexible and stay focused. Self-care is essential for our well-being and absolutely necessary every day, especially being in a continued state of a pandemic. So getting proper rest, hydration, exercise, fresh air, mental health, breaks, physical breaks from being online, on camera, and working remotely, all of this is vital to our well-being.
Yeah, I'd certainly agree with all of that. And, you know, you talk about wellness, and you think about the emotional wellness and what we've experienced over the past 18 months, past 2 years, and specifically around how racism and bias in the workplace has continued to persist. And I'm interested in understanding from all of you, and maybe we'll start with Pamela, to talk about, you know, Mount Sinai has really had a very long length of experience in moving all the needles, whether it's diversity, equity, or inclusion. But if we're thinking about advancing diversity right now, what are some of the things that you've done to readjust your DE&I strategy to handle, you know, the evolving and continued racism and bias in the workplace? And is there anything in particular you've accelerated, any initiatives you accelerated over the past year or so?
Sure, absolutely. So what we've done is really elevated and brought forth the need to address racism. You know, we didn't talk about that before. Many organizations really didn't embrace that as an issue. People didn't want to talk about it. So we've set that as an institutional priority. And it's not just something that's emanating from the Office for Diversity. It's something that we brought our institutional leaders together. We developed, I referenced earlier, a roadmap in our strategic plan to address racism and really dismantle those practices and policies and procedures and behaviors that exist within the organization. But a lot of that, I have to tell you, was predicated on learning and understanding. So we all know that people come into this with very, different ends of the spectrum in terms of their own understanding of what is racism. People react in different ways. People are defensive, and we really want folks to understand that these are structures that we're talking about. We're not talking necessarily about calling out, bad players and individuals, but we're really looking at those harmful practices and policies that have existed and are embedded. They're embedded in medical curricula. Many of you know, when we think about pain management, there are many things that are even taught in academic medicine that we had to reevaluate. Certain medical procedures, they're what we refer to as race correction factors when we look at kidney function, for example. So there are many clinical things where it's embedded. Looking at why are there differences in terms of wait times in the emergency room for certain people versus others. So what helped us with that, and COVID, I believe for all of us, brought this to the forefront, was having data. We were fortunate to have embarked on addressing our data collection so that we had verified background information on our patients' race and ethnicity, so we could start to use that to help us. And we really catapulted that work and brought it to our quality leadership team and made that part of the focus and elevated equity in terms of the work we do. I could go on and on about it, but I want to give my colleagues time to respond as well.
Sure, Raz or Dana. Dana, do you want to talk about what you've escalated in the past year?
Sure. So for us, Sentara, this is a newer journey for us. We're babes compared to Common Health and to Mount Sinai. My role was the first Chief Diversity Officer role, and I came in 2019, so just prior to all of this taking place. And I will say one of the things that really made me the proudest around how we responded was that our hospital presidents stepped up. And, we started off, at the death of George Floyd, we had a series of safe space conversations that we had overwhelming turnout for. And we had people from both ends of the spectrum. We had people who were able to have a space for them to feel solidarity in how someone else was feeling. But then we also had leaders who wanted to know, how can I be there to support? This is new for me. I haven't talked about race in the workplace before. Give us language, help us to do that work. So we went down that path. But then our hospital presidents reached out and said, Dana, we want to be a part of this. So each of our hospitals started up a diversity council, which was led by the hospital presidents. And the presidents, they could have sat back and kind of delegated the work to someone else, but the presidents have really stepped up and been right on point with addressing concerns, hearing the voice of staff that they normally might not have heard from before, and then moving to solutions and moving to how do we fix, as Pamela mentioned, some of those structural practices that just had been in place because it was how they always did it and did not realize the downstream impact of that. So that is, that's one of the things that we, for us on our journey, it was even just giving language to be able to start talking about race.
Thank you, Dana. And Rosalind.
Sure, thank you. Diversity, equity, inclusion is deeply embedded in our mission and values. Social justice is core and has always been a part of our Common Spirit Health strategy. The pandemic, what it did is it illuminated the impact of systemic racism during a time when it was unavoidable to not observe racism in a new way. And as a society, I believe many started looking at the impacts of racism as an evolving problem that was calling loudly for us to act and to act now. So Common Spirit Health leveraged this moment to advance more forcefully health equity, holding ourselves and others accountable to double down on what's possible for us as a health system and as a healthcare industry. We've invested heavily in our DEI strategy and are today positioned strongly in our Common Spirit Health 2026 strategy, with health equity as core and one of 12 priorities. We forged a historic partnership with Morehouse School of Medicine. It's a 10-year, $100 million partnership to train 300 Black doctors. I've added 3 diversity and equity vice presidents to my team this year. We've developed, in collaboration with over 17 functional areas who drive health and health equity, a roadmap for health equity for our organization. Our Office of Diversity, Equity, Inclusion, and Belonging, which sits in the office of the CEO, is now accountable to manage and drive this work for our organization to ensure that our collective commitment to make meaningful change and achieve equitable health outcomes is done effectively.
It's outstanding, the response of each of you. I want to leverage some of what I'm hearing in that most recent response, and I'm curious to learn, what you're most proud of. Dana, I heard you talk about that pride point and want to broaden the conversation beyond COVID, but certainly there's so many external factors that impact our industry, and we're all critical of and recognize that there's so much more that can be done. But I want to take a moment and reflect and learn from you all. What are you most proud of taking place in your organization, if you will, over the past year?
I'll start, and I'll say that overwhelmingly, it's been that we are now having pretty much daily conversations about racism, about groups that are oppressed, and about how we can do better, right? These are things that weren't talked about. And so when we talk about culture, we've gotten the organization, and this is, folks at all levels, to understand that racism is embedded in the culture. Again, it's not something an individual themselves just perpetuate, and then that becomes the issue. It's part of an organizational structure, and we're addressing it to dismantle it in an organizational, together as an organization, as an organization. And we're being very specific to drive that change using something that's called a collective impact approach, where we're bringing people in at all levels, so senior levels and also frontline staff and other voices. We want to hear the voices of everyone. So we're talking to our nurse leaderships, we're on units, and we are talking about things that are happening on a day-to-day basis. And again, trying to stop the harm, or at least listen to people, right? I think I heard Rosalind say it's important to engage in conversations with individuals about what's happening to them and recognizing it. And we all know from reading the books and educating ourselves, if you don't call it what it is, we're never going to get there and address it. So When someone says they've been treated in a discriminatory or racist manner, we have to hear them and believe them. And then for us now, we are setting forth what actions are we going to take to make a difference. And it's huge. It's not, it's not something that will happen. And we recognize it's a journey, but every day there are conversations about this at a senior level in the organization.
I love it, Pamela. You got to call it out, right, as you noted, while also recognizing that it's a journey. Dana, I'm curious to learn from you. What are you most proud of, given the work that you all are doing there?
One of the things that we have experienced has been the engagement from the board. So the board and reaching out to the community, our corporate social responsibility work has gotten even stronger. We are in the beginning stages of building out a pipeline program that's going to start from middle school all the way through and look at our end zone. So we're football season, right? So I speak in analogies based off of the season. So football season, the end zone is going to be, how do we close the gap at the fact that there are only 5% African-American doctors in the country? So we want to start socializing and building people up to say, I can be a doctor, I can be that nurse. We heard in the honorarium today, someone saying, no, you're going to be a nurse. That's what we want to start to build. And we're reaching out to the community. We have community partnerships with our area pastors, where we've been in conversation with them and asking them, what is it that you need from us? Pamela alluded to that around listening to the voice of the community. So we've been really engaged and looking at it with a diversity, equity, and inclusion lens, which is something that's different. It's one thing to just say we're going to go out in the community, but it's another to look at it through the lens of diversity, equity, and inclusion.
I love it. And the work that you're doing in the community, you're right, is absolutely impressive. Rosalind, again, you all have so much that you've accomplished over the course of the year. What are you most proud of as the lead diversity executive?
Well, thank you, James, again for the question. There's so much, as you said, to be thankful for and proud of. I'm going to go on a personal note. I must say the last 2 years have been incredible, with much to be proud of about Common Spirit Health. For diversity, equity, and inclusion to be elevated to the office of the CEO, I think is tremendous. It's tremendous across the country as well as our healthcare industry. And so I thank Kevin Lofton and Lloyd Dean. Being a direct report to the CEO has been amazing. Lloyd Dean is an exceptional leader, and being a member of the executive leadership team, leading the development of our health equity roadmap, and now being resourced with executive level team members to drive this work speaks volumes for what's possible when leadership at the top sponsors and supports the success of diversity, equity, inclusion strategy, as well as the work of the Chief Diversity Officer. Again, I thank my CEO, Lloyd Dean. It doesn't happen overnight. It requires the support and the encouragement from many, seen, unseen, and behind the scenes. And that's why NACI remains vital to keep at the forefront the focus on promoting the success of African American healthcare leaders. I'm very proud of the work that we're doing, as well as NACI.
That's great. So thank you, three. I was taking notes, right? I mean, to summarize that first section around advancing diversity, I took really 4 major key points that it requires strong leadership, right? And I think that you all can agree that the 3 leaders that we have here are strong leaders and have leaders that they work with across their organizations that are strong leaders and committed to diversity, equity, inclusion as well. I think it also takes, and we've heard, it takes board support and accountability at all levels. And I think we can take that as a way as how do you advance diversity. The third piece is that we have to hold people accountable, starting with ourselves, right, as diversity leaders, or if you're individual contributors in your organizations, hold yourself accountable and hold others around you accountable by having conversations that are needed at different times. And then finally, I think what I heard is that organizations have to put their money where their mouth is, right? We've heard from each of our panelists that this has required some capital. This requires either capital in the form of human resources, or other technology and tools that can truly help to advance diversity across organizations. So now I'm just going to kind of shift gears to talking about developing inclusion. And so I'm going to start with Pamela because, and then we'll go to Dana, then Rosalind. But with Pamela, you kind of, you touched upon this at first when you talked about data and the use of data at Mount Sinai. I'd like to hear more about how you're using the data and how you specifically use your patient and your workforce data to understand inclusion at your organization. What data do you use, and anything that you can offer about that?
Sure. So I'll start with data relative to our staff, our employees. So we all are focusing on leadership and advancing leaders and talent pipeline programs and such, right, to bring in more folks from underrepresented groups. One thing I just want to say is kind of a point of caution is, as we bring more leaders in, right, leaders of color, vice presidents, I know Rosalind said she's just hired some more folks into her division. We want to make sure that we're bringing them in and they understand the culture in which they're working and what they're going to be dealing with, right? I've had recent conversations with leaders, so we want to make sure that we're supporting those Black and brown leaders that we're bringing in, or other levels of the team, so that they're able to understand how they can be successful. So that simply involves us right now as it relates to people, making sure we have the correct information. I've learned over the years, both on the patient side and the employee side, and I've worked in, as you know, Cassie, in HR for many years as well, human resources, that we also hadn't made a priority of how do we collect this information, either from our patients or staff. How do we make sure that this is really the data integrity? So there should be a commitment to data integrity. We identified, and I would venture a guess this may exist in other places as well, where people were not focused on it. Supervisors, managers had not emphasized the importance of why we need to make sure we have people self-identify, especially patients at the front desk. And I learned by myself going out and doing sessions and meeting with frontline teams to understand what does it feel like. We also brought our patients in and asked them, we did focus groups to find out how can we best get information from you? What makes you comfortable or uncomfortable? So again, hearing the voice of those individuals. Once we have that information, which we now believe we have our data integrity is in a good place as it relates to patients, we're then able to take that, and we have the good fortune of having a research and medical school to use that now in a very statistical and scientific way to do it, to explore what's going on with outcomes, and in a way to look at what really does correlate. And we also, you know, we have a fabulous team of folks who can do that data research for us, or analytics, to really look at other correlating factors, zip code, other factors other than just race. And I want to say this very carefully, that we don't want to be in a situation where people assume or expect that Blacks and Latinos are supposed to have worse outcomes. Right. So when you think about COVID and other information, we look at it and we see that, you know, the numbers are, you know, folks have died or higher among those groups. What ends up getting embedded in thinking is, well, that's what's supposed to happen to them. But that is not what we're focusing on. And we've spent a lot of time with our quality leads so that they understand that we don't want to blame the individual for being Black or Latino and therefore they have a bad outcome, because that upholds those embedded racist principles that's part of medical curricula. So we're doing a lot of work on changing the thinking, right? And what's driving the fact that they have those outcomes? Because believe me, it's embedded that, well, that's what's supposed to happen to them because they're Black or Latino. And we see that when we look at maternal mortality, morbidity, and those numbers for Black women who are dying at a 3 to 4 times rate higher than their white counterparts. And why is that, right? So we are very deep in this, as you know, so we've taken it to really critically analyzing what's going on. And again, having that data science and research has made a significant difference in how we're approaching the work that we do.
Great. Dana?
So one of the things that we did in terms of analyzing data for our employee engagement survey, prior to 2019, we would look at, and we worked with Press Ganey, right? So we would look at our engagement score and say, oh, okay, we're 4.11 in engagement, yay us. But what we did was we changed the dynamic and we changed the conversation. We disaggregated the data. And we began to look at it disaggregated by race, ethnicity, by gender, by tenure, and by generation. So that first year, we started to look and say, okay, we've got some people who are experiencing Sentara at one level, and then we've got another group of people that are experiencing Sentara at a completely different level. And how do we, number one, close those gaps as well as raise the overall experience? And then last year, we took it a step further and we gave people the opportunity to self-identify if they were a member of the LGBTQ community, if they were a member of the disability community, or if they were a veteran. Because again, we wanted to get that full experience and recognize the different layers and the intersectionality of our diversity dimensions. So through doing that, we saw where there were definitely pockets of opportunities for us to start to engage in, as well as build trust into the process, so that for those questions where people self-identified, they had more of a sense of trust that we were not using it to point any particular person out, but we were really looking at it because we authentically want to know, what is your experience at Sentara and how can we make it better and how can we create that sense of belonging?
And Roz.
Sure, I'll share 3 points here. To answer the question specifically around patients and our workforce, our employee survey has specific questions on diversity, inclusion, and belonging. Additionally, we cut across the survey to make sure that we're capturing the race, ethnicity, and gender demographics to see how our employees are scoring on other areas of the employee experience. And as I mentioned earlier, part of our health equity roadmap focuses on data. It's one of 5 priorities. We know the importance of data being interconnected, interoperable in order to have data-driven interventions. And we have created a health equity dashboard. I'm very proud about that. And that dashboard will capture data around supplier diversity, our partnerships, advocacy, as well as our capture of real data. For FY22, we have a health equity metric that's tied to our incentives. And what we're doing there is improving, the quality of our data capture, as well as how are we going to improve the behavior and how we obtain this information. And for it to be tied to incentives, is tremendous. It's a tremendous commitment of our organization. We're also bridging the collection of SOGI data, which is sexual orientation and gender identity. So our focus on data is strong. We're using it to improve how we deliver healthcare.
Outstanding, outstanding. But Pamela, your response to the prior question made me think of this current question. Talent management, learning and development is one of the corporate functions that I have responsibility for leading here at UPMC. And I know that some say that diversity training is the answer to all things bias, right? I'm curious to learn your reaction to that statement, but also what are some of the efforts that you all have underway to train, if you will, around unconscious and conscious bias?
Sure. So I'm one who doesn't like to use the word train. I like to say educate and provide people information so that they can kind of bring about their own awareness. So since 2015, we've been using education for mitigating bias as one of the major things that we've pushed out to manage to folks at all levels in the organization. But again, I want to be cautioned to say, doing an education session, doing a training session doesn't solve the problem, right? So it's work that has to be ongoing. So oftentimes we hear people just say, well, we have to come in and do unconscious bias education and everything's fine. Well, it isn't, right? What you want to do is create the sense of urgency that we want people to focus on themselves, right? Not others, because oftentimes people are pointing fingers. What is it? What are your own? What are your own associations with bias on any level? And it includes all of us, right? When you see people from a particular background, if it's in the interviewing process, do you only pull people from certain schools? Are you only looking at, folks with certain degrees? How are your job descriptions written? Do they, in terms of just how the language you use, is that biased? So biases and such can exist at so many different levels. In terms of personal interactions, like anyone else, we want to make sure that people are not using offensive language or behaviors towards others. So again, part of our work is to encourage people to come forward and report when they've been treated in a way that they believe is biased, discriminatory, or racist. And we have different ways that they can do that on a confidential level related to patients or related to interactions with one another in the organization. And so what we encourage, rather than sending someone off, unless it's completely egregious, but instead of just sending people off to be punished, going to HR and get scolded, we really want to have conversations about what happened. So we're empowering people to use their voice. So for example, if someone says something to you, you could say, can you please explain what you meant by that? Or you can let people know how it landed on you. You can let people know that you were uncomfortable with what they said, and there can be conversations. We just put forth a policy on managing racist patient behavior. So many of you, I'm sure, deal with that as well. We've been spending a lot of time in that space working with our teams because we know that we have patients who come in and they say things that are egregious. And how do we do that? One of the most important things that we put forth is that this is not work that Black and brown people are doing themselves, right? So this is not just, we're people of color. It doesn't mean that we own all of this. So what we encourage is for other colleagues, our white colleagues, our other colleagues, to stand side by side others. So if you see someone say or do something, come forward and support your Black or brown colleague or anyone else who might have been offended, any other group that might be marginalized from whatever background they might be. So it's constantly talking about that, but within ODI, within organizational development, yes, we do have education. We do have sessions on managing difficult conversations about racism and bias. We do put, again, we regularly go out and work with teams on managing and mitigating bias. So we do have a number of platforms to do that work, but we keep encouraging people. You have to get into having your own conversations and working with your team. So it's a skill set and a competence now, really to be effectiveness. So we're making that part of, our leadership, competencies. Do you have the ability, do you have the competency to have these conversations and to work towards, supporting and instilling an anti-racist organization? So we're, again, holding leaders accountable for those behaviors as well. So that's work that we're doing through our talent development group, in addition to all the other programs and pipeline and developing folks in the to advance in the organization.
Outstanding, outstanding. Dana, can you speak to work and efforts that you all have underway to mitigate bias and some of the learning and training efforts that you have within your organization?
I'll piggyback on what Pamela just talked about. It's, the training is really the education, especially in an organization where this is new. So a lot of it has been level setting, creating clarity around what certain terminology means. Because some people will, you can mention certain terms and everybody will walk away with their own definition of it. So we really wanted to set some, conceptual clarity around terminology. But then we also didn't want it to be a you've been taught, now you're healed kind of situation. We really wanted to look at structurally, where does bias play out? That's where the real barriers exist. And that's where people, if you look at it from a structural practice and policy perspective, people will get less defensive because you're not pointing the finger at them as much. I've been thrilled at how many people have across our hospitals reached out around, we want to get this education, we want to understand what it means, but then also looking at structurally, and Pamela mentioned it a little bit, it's when we're looking at how we recruit, in the past, we might have done something like, oh, well, we put a posting on a website and thought that would be the check the box, why aren't they coming? And really having more of a conversation around, how do you develop the real relationships? How do you develop, this work that we're doing, this partnership that we're doing with NACI? How do you leverage those organizations? People at Sentara are used to me using the analogy of, you can't go fishing in a guppy pond expecting to get catfish. We've got to go to where the catfish are jumping. So that is what we've been doing, is really helping to reframe, the bias of, where we've been going, and recognizing that, people are out there. We just have to go to where they are and develop that relationship so that they know that this is a place that they can come and thrive. Something else that we've done, as Pamela mentioned, over the course of the last few years, tensions have been very high in terms of that patient interaction. So we have a workforce violence prevention team. And when I joined the team, it had already existed. When I joined the team, one of the things that I introduced and we added to the language was the terminology about microaggressions. We were typically thinking about workforce violence more around the physical violence and not recognizing what kinds of microaggressions that our clinical staff were going through. And then it was interesting in doing one of our safe spaces conversations, when I started talking about microaggressions, there were people that didn't know it had a name. So going back to that education, there were people that were saying, I didn't know that there was a name for what I experienced that from a patient. No one ever told me that it was a thing. I thought it was in my head, which is actually, that is the ugly part about microaggressions, because you experience them and you feel like it's you versus that this was an actual thing. So we've been doing a lot of work around that, and that has really helped people give language to be able to speak up and give a voice for themselves.
Outstanding, excellent. And Ross, we certainly want to hear your perspective as well here.
Oh, thank you so much. We have several approaches to disrupting bias. We have diversity and health equity insights that are pushed out every month to over 9,000 leaders, where we celebrate, we acknowledge, and we educate. We focus mainly on those 9 federal heritage months, and then we weave in health equity facts. And that is well received amongst our colleagues. In addition to that, we've had meaningful conversations. At the height of the civil unrest, we found that individuals needed to be heard and that they wanted to understand what they could do. So we provided a video, a guide, how you have those courageous conversations. And it is through that connectiveness that we experienced that we believe that we were disrupting bias. And then in a very, very structured way, we focus on unconscious bias and culturally competent care. As a matter of fact, I recently had this very conversation with Dr. Nathan Ziegler. He's one of my new hires, our Assistant Vice President of Diversity, Performance, and Excellence. Many of you all may know Nathan, but here's what he said about unconscious bias. He said, when you look at unconscious bias from a psychological standpoint, you can understand why some people might make the assumption that training will fix it. Then he went on to say the theory could be made that if you train someone to be aware of their biases, then they would be able to fix those issues related to it. In the same way, when a person doesn't understand a culture or what behaviors are racist, for example, then one could learn the things necessary to be more inclusive in their interactions with others. The problem here is that structural and systemic racism are deeply embedded within our society. Thereby only looking at bias or ignorance as the cause, we're failing to address the real issues. So yes, on an individual level, we can do more to be aware of our actions, and training can help with that. However, we must invest. And I see Pamela nodding there. We must invest more to address the structural barriers to equity.
Yes.
We have to look at the systems, the structures, the policies, and the laws that create inequities. In that way, bias training and cultural competency training can equal maybe 15% of your strategy, but the rest has to address the structural and systemic barriers.
I just have to say, Rosalind, absolutely, because what I know you all didn't give me the floor, but I'm taking it for a moment, is that what ends up happening, just to that point, is that it becomes a proxy. They'll say, well, they had bias trainings. And again, it's people not wanting to address racism. And, biases are biases, and it's I don't want to get into all the definitions, but biases are associations that we all have. We all have biases, otherwise we wouldn't be able to survive. Structural racism, oppressive practices are very different things. And we have to understand that. And people like to use bias instead of saying the word racism, and it's not the same. That's so important, Rosalind.
Thank you. I think that, there's so much that goes into developing inclusion, and we could spend a whole afternoon talking about strategies, approaches. In the Q&A part, there is a question about data, and we'll circle back to that later, but I do want to just go to elevating equity. And I want to ask, we've heard from Rosalind about one of the very, very important ways Common Spirit is elevating equity in preparing and training the future providers with the collaboration with Morehouse. But want to specifically ask about, the commitment to minority and women-owned businesses and how, if that's changed, and some specific examples, and maybe start with Pamela, specific examples of how Mount Sinai has truly leaned into making sure that we support minority and women-owned businesses.
Sure, absolutely. So again, it's going back to calling it out. So we've elevated equity to be a core value for the organization. And then again, it's the communication of that. So again, working with leaders, and our board has adopted all the work that we're doing as well. So in dealing with our supply chain leadership, once you let folks know this is where we're going, we've had efforts underway in the past for many years, but really bringing more people to the table. So other leaders, hospital presidents, folks who were in charge of, vice presidents of materials management and other areas who were big users of products and make those decisions, come together. And now on our what we call our value analysis committee, it is absolutely an agenda item or a discussion point. Let's look at what we're doing and how many dollars are we allocating to those MWBEs, right? And so it's a specific category that's tracked and discussed. Without it being on the agenda regularly, without it being a priority, it gets forgotten. So we continue to do work in that space, and that group meets regularly. We have a process where we also are working with community vendors, and I think this is one of the best practices. And I know this is Rosalind's specialty, and she does this so well, and actually I've learned a lot from her, is that you also have to engage with your community and your vendors. I always make this analogy. If you were a small vendor walking down the street in New York City, how would you even know how to get to the door to do business with Mount Sinai? Who's going to open that door? So equity has to do with access, right? Who's being left behind? Who's not being let in? How do they get there? So we know that. So that's again, I always say, where's your lens of equity in terms of the space? So we are doing that outreach to the community, bringing them in, getting them set up in our system, teaching them, our payment terms, making allowances where needed for folks who can't wait the 90 days to get paid, those types of things. Those are all barriers. It's all structural, again, going back to oppressive practices and structural racism. People have been left out. And I always say this is all by intention, right? These things are not accidental. So we're dismantling that. And so at the supplier diversity table, that's part of the focus ongoing.
Awesome. Thank you for that. And so I think that we can again go on and on around equity and what we really have to do to elevate equity. There's a couple of questions in the Q&A that I want to make sure that we get to. And we're going to save a couple of minutes from the end because I want our panelists to think about a provocative question that James will ask at the end around advice to people. But before we get to that question, there's a couple of questions that I want to kind of put together. One question is around, does anyone have an example of a person who either witnessed or was a victim of racism or discrimination, and how your organization handled it? Of course, without names or anything like that, but just a real life example, because people believe that policies and training, yes, we do that, but the rubber meets the road when we actually lead in a sense that shows that there is not a tolerance for racist behaviors. So I'd like to go to perhaps I see you shaking your head, Pamela. And then maybe you can give us an answer to that and ask if Roz or Dana, by the nod of your head, would like to answer that as well.
Sure. So I have many examples because, again, that's in the thick of the work that we're doing. But I'll give you one that was more positive in terms of the outcome. So, and I'll do it very briefly. So on a patient unit, it really related to the way a patient treated a staff member. And when that staff member, caregiver, would go into the room, the patient was rude. It would make derogatory comments. And these things happen regularly, unfortunately. And what happened in that case was the caregiver happened to have been a person of color, but one of her colleagues noted how stressed out she was on what was going on. And she said, and they came, and her colleagues came to her defense and said, we're going to go back in the room with you, right? And they called out the patient and said, you know, this is not, we don't tolerate this. We have a no tolerance policy for racism in our organization. And they actually asked the caregiver if she was okay going back in. So they were there to, again, and Rosalind, I think, said this earlier, that support, that mental health, it's important that we want to support people through these difficult times. It's not just the incident, it's again, the harm and the stress and the anxiety that folks bear. So her colleagues were very supportive, and that's really the ideal, right? That's what we want to happen and have happen ideally, is that these things are spoken about in the moment, and that you have others, you know, surround you or help whoever is being subjected to this behavior, supported by others. And that's the model that we put out there. So we have many stories. Some don't end up as good as that, but that's the model that we put forth and hope to have emulated throughout.
Yeah, I have another question from the chat, and it's a really good question, because as I look and think about the panelists, as well as the organization that James represents, and the organization that I served as the diversity leader and chief experience officer, really big organizations, right? And so we have a lot of our audience that come from community hospitals or smaller organizations that may not have 3 VPs in the office of the CEO, or may not have, you know, a small and mighty even team in the HR area as Centera, and definitely may not have what Mount Sinai has, that has kept them at the top of Diversity Inc. But what are some suggestions that you would have for these community leaders, community hospital leaders, or small leaders in FQHC or something like that? What can they do to really get the data and learn how to use the data? I have an answer, but I don't want to be biased, given that I work at Press Ganey. And you know, one of the things that we have created is the Equity Partnership, which is free for any of our clients. And so that was my immediate response. But beyond that, anybody else have any suggestions on how our smaller organizations can truly lean into this work? I'll go to Rise.
Well, thank you. Well, you know, we lean into Press Ganey at Common Spirit, a wonderful business partner to have. And along that line, I would encourage them to lean on the community. We're a very generous diversity, equity, and inclusion community. We share all the time, be it phone calls, consortiums, emails. We talk on a regular basis on best practices. You do not have to reinvent the wheel. Learn from mistakes we've made and things that worked is what I would encourage anyone to do. And when you talk about what you may or may not have compared to other organizations, what you do have, and I believe is true of most health organizations, you have those values that you can lean on in terms of inclusion and compassion and excellence and integrity in the delivery of healthcare itself. That aim of quality, it commands us to do this work. And to find a sponsor, you have colleagues, I guarantee you, who are committed to this work. Lean on them to support your work and partner with them. Through collaboration, we can get a great deal done.
Awesome. James, you want to?
Excellent. Thank you, Casey. I appreciate it. I think, you know, there's so many people that are watching this right now, or that will watch this, right? And you're speaking to an audience of diversity practitioners or diversity officers or NACI members that don't officially have a diversity title, but they're so connected to and committed to this journey. I'm asking the three of you, what advice do you have for individuals that are a part of this industry, that have dedicated their career to advancing issues of health equity and employment, ridding employment disparities? What advice do you have for individuals who want to advance this work of diversity, equity, and inclusion?
So James, I'll jump in because this work has to be hard work. This is not work that you do just to get a paycheck. If for any of us, I am sure that if this was just a paycheck work, some of us may have changed industries a long time ago. But this has to be hard work for you, but you also have to set your own boundaries because it can be very complex. And I experienced this back when George Floyd was murdered, that I was busy doing the work and wasn't paying attention to how it was also impacting me. And it wasn't until someone checked in on me to say, hey, Dana, how are you doing? Because I'm out there facilitating the conversations and having the discussions around what we do next. And I was doing. And I had to take a pause and really reflect on how was I feeling? How was I doing in this work? And I think, going back to what Rosalind said about having a community of practitioners that, we are all giving and all sharing. So make sure that you find people that you can lean on, lean to, get advice from, because that is going to be what sustains you in this work.
Okay.
Pamela, you have about 30 seconds.
I would probably just add, it's difficult to do, as Dana said, it's really difficult, but you can't think about as taking it all on to do it yourself. But if someone is trying, and it depends on what your positional power is within an organization, because when we look at structures and organizations, again, who has positional power? If you could align yourself with someone who has that positional power and have them take the lead in some of the work, that's also helpful, right? You give them ideas, you partner with whoever it may be, and you start to share. So I always say to folks, especially when I'm working with young people and students, watch who has the power in a room, right? And that's where you might want to align some of your efforts and your thinking and direct some of your things that you want to get set forth as it relates to DE&I. And it might have to be in small increments. You can't go in and dump a bunch of stuff on them, but have conversations with them, ask to meet with them, share some ideas, and then let that person help you to weave in some of the DE&I tenets that we want to get accomplished. Because oftentimes, as Dana said, we're standing around just running around doing everything ourselves, right? Thinking we can just change the world. But it's not going to happen that way, because it has to be embedded. It's not something that sits outside of the organization. You need it embedded in all aspects.
Thank you. And Raz.
Sure. I'm going to say what to do and what not to do. How about that? So when you think about diversity, equity, and inclusion, it's core to everyone's role. It's just not upon us. As a matter of fact, you don't want it to be a check the box. Oh, get her to do it, get him to do it. We all should be doing this and seeing the work through a lens of diversity, equity, and inclusion. It should be an overlay to every strategic priority area of the organization. And I believe there is a place with every individual, with every functional area, that they're willing to work with you. You need to find out what that intersectionality is, start there, and move forward. As people experience success in this work, they're more likely to trust, to advance, and do more. And especially to the extent that it helps them to achieve their business needs. They see you as essential. You're partnering with these folks. What not to do is to take this on as your personal pulpit. We are employees of an organization. We have to move with the organization. Find a way to advance diversity, equity, and inclusion in a way that is in alignment with the organization. Otherwise, you're out of alignment. And that's where a lot of, I think, diversity and inclusion folks get out of whack with their organization. They're off on their own agenda. That's not the way to advance this work. And you won't last long, as simple as that. You have to be there to make a difference. And it takes time to build the relationships, the credibility, and the trust to move the work. So hang in there, keep pushing, don't stop, is my advice.
Oh, thank you so much. And this has been, a great conversation. We really appreciate our sponsors, Sentara. I appreciate my co-chair, James Taylor, and definitely want to thank and recognize the continued great leadership of Pamela Abner, Dana Becton, and Rosalind Carpenter, all who have really provided us a lot of great information. And so we want to just shift over to another really important part of today's forum, and that is our Young and Senior Healthcare Executives Awards.
Hello, my name is Brandon Batiste, and I'm the Young Healthcare Executive of the Year Award recipient for 2020. And I'm here to introduce NACI's Young Healthcare Executive of the Year for 2021. The Young Healthcare Executive of the Year Award recognizes and celebrates the major contributions and efforts of young African-American healthcare professionals in the field of healthcare and NACI. And it is my pleasure to announce this year's award recipient. This individual has been a NACI member for over 7 years, and they have over 13 years of leadership experience in healthcare. This individual has been involved with NACI at the local and national level. They have participated in the Everett v. Fox case competition, served in NACI's mentorship program, served on numerous judging and speaking panels, and helps locally with chapter programs. This individual's major contributions to healthcare include leading the disaster response for H1N1 efforts for Duke Health System and University, including the advancement of Duke's influenza vaccination program. They also oversaw field disaster team deployments to Haiti and various coastal locations for hurricanes impacting North Carolina. Policy issues this individual has actively supported through lobbying and advocacy include trauma center support and funding, helmet laws in North Carolina on behalf of trauma centers, and the substance use disorder prevention that promotes opioid recovery and treatment for patients and communities. Their involvement in community organizations is impressive, having served on countless boards, founding Chief DC, and member of Alpha Kappa Alpha Sorority Incorporated. And it doesn't stop there. Last year, this individual and their spouse established a family scholarship at UNC Chapel Hill School of Public Health, an endowed scholarship providing financial support for female healthcare administrators, master's students committed to supporting healthcare diversity and health equity in their career. Please join me in congratulating this year's Young Healthcare Executive of 2021, Jessica T. Melton. Jessica T. Melton is the President and Chief Operating Officer of Suburban Hospital, a member of Johns Hopkins Medicine. I will now turn it over to Jessica to provide a few remarks. Thank you.
Thank you. It is such an honor to receive this award. There are so many incredibly deserving leaders across our membership. I would not be here to accept this if it was not for the leaders that came before me, those that have been not just mentors, but have been friends, have been family, and most importantly, have been sponsors in my career. Members in NACI have been there for me as I've made decisions, as I've considered opportunities. They have helped look at my resumes, they have made calls, they have been recommenders. In fact, this is a full circle moment for me. 15 years ago, I joined NACI as a case competition participant right here at Johns Hopkins at Baltimore. I joined Johns Hopkins this past April, and I'm proud to say it's because of NACI and because of the leadership that I saw before me that I had the vision to even aspire to these opportunities. Seeing people that look like you, seeing people that have the same values as you inspires. Our mission here matters. And I am here to share with our early careerists something that was said during the case competition and my first experience at NACI by our then president, Dr. Christopher Mosley. And that is, as careerist, mid-careerist, senior careerist, we are here to lift up. We are a ladder to others. To improve our mission, to serve our communities means to give back. And so I am proud to be a part of that ongoing legacy, and I commit to continuing that chain. Thank you to everyone, and thank you to my nominators.
So good afternoon. I have the pleasure today of presenting the Senior Healthcare Executive of the Year Award, which recognizes and celebrates the major contributions and efforts of a senior African-American healthcare professional in the field of healthcare and at NACI. This individual is a trailblazer and has championed numerous major contributions to healthcare, specifically related to advocacy, public policy, and program development to address social determinants of health and to eradicate healthcare disparities. This executive is also a passionate leader and voice for equity. A trial attorney by training, she spent her earliest years in public service representing disenfranchised members of the most vulnerable populations. An effective advocate and researcher, she became the first African American to serve as Chief Policy Counsel in the New Jersey Governor's Office. Prior to working in the Governor's Office, this leader broke barriers in the New Jersey Department of Treasury, where as the first African American woman state treasurer, she created the Treasury's first Office of Supplier Diversity and Division of Minority and Women-Owned Businesses to ensure equal access to revenue-generating opportunities for those populations. Before being appointed acting state treasurer, this leader was the youngest executive director and CEO of the New Jersey Lottery, where she generated revenue numbers that were record-setting. Any idea who this is yet? As if these accomplishments weren't enough, this executive was also the first woman and the first person of color to rise to the executive vice president level at one of the largest healthcare systems in the country, RWJBarnabas. This executive is also active in her community. She serves on the board of governors of Rowan's University at Rutgers Camden. She's a member of the board of Executive Women of New Jersey and a trustee of New Jersey Women Lawyers Association, just to name a few. Not surprisingly, she has received numerous awards and accolades for her professional accomplishments throughout the years. A recognized and requested speaker, she's an inspirational orator with a natural ability to connect and to communicate simultaneously while challenging her audience. She's an honor graduate of Seton Hall University, and she holds a Juris Doctorate from the Seton Hall School of Law. Please join me in congratulating this year's Senior Healthcare Executive, Micheline Davis. Micheline Davis is currently serving as the President and Chief Executive Officer of National Medical Fellowships. I'll turn it over now to Micheline for a few words. Congratulations.
Pamela, thank you so very much for that incredible introduction. And to everyone in my NACI family, I see you, Rosalind Carpenter. I see you, my friends and family. Thank you. Thank you for this incredible honor. It always means the most when it comes from your own. And that is exactly who NACI has been for so many of us, and it is exactly who you continue to be. Thank you for this incredible honor. I am humbled. I don't even know who nominated me. And so to everyone on the nominating committee, to everyone on the selection committee, and to every single one who has gone before us, who has built a well from which we all drink today, who literally put every rung on the ladder so that we can rise together. I dedicate this to you. I dedicate this to every single clinician of color, in particular those of African diaspora, to every administrator, to every operator. You, my friends, are the reason for being for so many. You are the only hope we have in actually conquering healthcare disparities. You are the reason why I left RWJBarnabas and came to National Medical Fellowships, so that we continue a diverse pipeline of clinician leadership, but more than that, so that we are building the environments where we are not merely changing systems and structures, but where we are now in positions to lead those systems and structures, so that when that strategic tension likes to show up and keep the status quo, we're actually in position at that time to say, oh no, no. I don't know about you, my brothers and sisters, but I'm done dying. And so because each and every single one of you has dedicated your lives to ensuring that we get to live, I say thank you. To Pamela Sutton-Wallace, you know how I feel about you. I just had the honor of honoring you for the National Medical Fellowships. Thank you to each and every one of you, and Godspeed.
Congratulations, Jessica and Micheline. So well deserved, and I am thrilled for both of you. NACI family, we hope you enjoyed this morning's program just as much as Dana and I did. Up next is an educational session starting at 1:00 p.m. Eastern Time. This will be followed by the Young Healthcare Professionals Forum to conclude the day. Dana and I would like to thank the Diversity, Educational, and Young Healthcare Professionals Subcommittee co-chairs for working on today's incredible programming. But that's not it. We have more for you tomorrow. Starting at 12:30 p.m. Eastern Time with the Public Policy Forum moderated by Tiffany Cross from MSNBC. This event is sponsored by UPMC and you won't want to miss it. So please enjoy the rest of today's sessions and don't forget to vote for your NACI officers. We'll see you tomorrow.